Thank you for joining us today. Welcome to the Leukemia and Lymphoma Society Living Well with the Blood Cancer virtual conference. Unexpectedly pausing some of your life goals as you confront a blood cancer diagnosis may cause you a great deal of worry. When you're in or out of treatment or navigating a chronic blood cancer, taking care of your health and well-being are especially important. This week's long conference will offer you interactive presentations and expert-approved tools, tips, and recommendations to improve your quality of life so you can live well with or after blood cancer. Let me introduce myself. I am Caroline Mitchell, the Community Services Manager for the LLSC. I will be the host of this online event today. The presentation will last approximately 60 minutes and will include a question and answer period at the end. Since there are many of you with us today, we invite you to type your questions and comments in the question box of your Zoom webinar panel throughout the presentation. An LLSC staff member will monitor the questions. I will read some of your questions aloud at the end of the presentation during the question and answer period. The conference will also be recorded, therefore you can listen to it again on our website. Before we begin our main presentation, I'd like to share with you our mission and highlight some of our resources that may be helpful for you or someone you know. At the LLSC, our mission is to cure blood cancers and improve the quality of life of those touched by a blood cancer and their families. We offer guidance and support every step of the way. The community services managers across Canada can help. They are compassionate connectors that can help you cope with a blood cancer experience. Please do not hesitate to contact a community services manager in your area. They can be reached by email at info@bloodcancers.ca or by calling the toll-free number 1-833-222-4884. Next slide, please. The LLSC has many services to help you through the blood cancer experience. One such service is our peer support program. It's a support service that matches people affected by blood cancer, caregivers and their families, with trained volunteers who've been touched firsthand by a blood cancer and share a similar experience. Whenever possible, participants and volunteers are matched based on their age, gender, and diagnosis, or an issue that is most concerning to you. Next slide, please. On our new website, bloodcancers.ca, you will find a variety of educational resources and support services. For example, there you can access free booklets and fact sheets containing information about specific blood cancers, treatments, and practical information. You can also find short animated educational videos, past webcast recordings, as well as access our many podcasts. Next slide, please. It is now my pleasure to introduce our conference and speaker for today. Nutrition, the power for strength and wellness in blood cancer. Good nutrition is important throughout your cancer experience. Margaret Martin, registered dietitian and certified diabetes care and education specialist, will share 2 tips on how to stay hydrated, what to eat, and foods to avoid, and debunk myths and facts to help support you as you navigate cancer treatment and recovery. Margaret Martin is a licensed dietitian and nutritionist in the state of Tennessee, as well as a certified diabetes care and education specialist. She's worked with the Leukemia and Lymphoma Society's Pearl Point Nutrition Services for over 5 years. She contributes to Nutrition Handbooks, LLC, LLS Health Manager Smart App, and the website for Pearl Point. Please join me in welcoming Margaret for her presentation.
Thank you so much, Caroline, for that wonderful invitation. It's indeed a joy and honor to be here with you all today. I bring greetings from the United States of America. We have several goals today on our agenda, 5 to be exact. One is an overview of LLS services. Secondly, a short definition or concept of what is living well on your cancer journey. Also, we'll be touching on some nutrition facts or fictions and trying to give you good information on making decisions about evaluating nutrition information. Then we'll finish with how to manage some popular side effects or frequent side effects and share some resources that hopefully will help you, or if you're a caregiver, it may help you and your loved ones on the journey with cancer. First, I wanted to start with our Information Resource Center. That is the hub of our information and resources here at LLS. With one phone call, you can be connected with someone who's a health professional with advanced degrees that can help you get more information about your diagnosis, treatment options, support groups, local and virtual, as well as resources. As Caroline was speaking about, the First Connection program is one of our most popular programs. We also have online chats that are monitored by a health professional so that you can connect with other people with a similar diagnosis. And we also have support groups, virtual at this point. And we're here to help you along the entire continuum of your cancer journey, from pre-diagnosis all the way to post-treatment. Also, we have a clinical trials resource center. If you're looking for a clinical trial, we have nurse specialists to help you with that as well. One very helpful item we have is our Health Matters app for your smartphone. You can track your doctor's appointments as well as many nutrition related activities like menus, recipes, grocery list, side effect trackers, and recipes as well. You can also track your hydration. So this is an award-winning app that many hundreds of people have enjoyed this past year. Also published at the end of last year is our Nutrition Handbook. It's a great place to start for planning your meals, getting basic nutrition information for feeding you and your family. We also have 3 days of menus with selected recipes as well with recipe cards. And this is a free request or download from our website. Now, as we're talking about nutrition today, I did want to let you know about our offering of a free one-time nutrition consultation. We offer these by email or telephone, and they can be on a variety of topics about nutrition and cancer. For you, or if you're a caregiver, we can talk about you as a caregiver or your loved one. We have offered these for over 5 years. It's been a very popular service, and a registered licensed dietitian will be speaking with you on the telephone or through email. You can schedule a nutrition consultation by giving us a call, 877-467-1936 is our direct number, or you can call the Information Resource Center at 1-800-955-4572. If you'd rather use our online calendar to schedule an appointment, that's a great way if you have a digital device to select your own appointment on our website. Now we do have the lls.org traditional website, and then we also have a beautiful nutrition website. It's called pearlpoint.org/mynutrition. We have information on side effect management, nutrition suggestions listed by type of cancer diagnosis. We include blood cancers as well as all types of cancer on that website. We also have recipes, food safety guidelines, tips for food preparation and planning, as well as some other great resources and blogs to help you along the way. So do check that out, pearlpoint.org/mynutrition. Well, just to tell you a little bit about me, I became very interested in oncology nutrition when my father was diagnosed with cancer. I was working in community health at that time. Then my mother also developed cancer as well as my sister. So I learned through that experience how vital the family, friends, and neighbors can be to help people shop, prepare food, go to the grocery for you, help you store food safely. So I eventually changed my focus from community or general nutrition to oncology nutrition. Now, although my family members all had the same organ affected by their cancer experiences were very, and their treatments were very unique. Therefore, their side effects and nutrition issues were very vast and different. So that can be the same in your experience too. You could have a blood cancer, but that can be very different in how it's treated and your reaction to the treatment versus, say, breast cancer or colon cancer. I say that just to remind you that oncology nutrition isn't a one-size-fits-all type service or challenge. So what helps you may not help another person in your family or neighborhood. So you need to get information that may be specific for you, your health, and your treatment and experience with cancer. So let's talk about living well. Each person or family often has a definition for what they define or believe living well means. Sometimes it's about the kind of house we live in, the neighborhood, our income of the home. Sometimes it's about how much travel we may do, not so much during this COVID time, or how many toys we might have at our home. But for our purposes today, I believe living well is more holistic than materialistic, shall we say. And it's different for each person and family. So living well might be defined as having well-being emotionally, physically, and mentally. Also, eating healthy often. You don't have to be 100% about eating healthy foods, but I think if people are choosing healthy foods 75 to 80% of the time, I think that supports wellness and health. Number 3 has to do with activities of daily living. Another aspect of living well might be living as independently as feasible for you. Being able to do things for self-care, and if you are still working, to carry out your activities at work as well at home and with your friends and family. And lastly, emotional and social well-being is a big aspect of living well. So linking effectively with people who are important to you, I believe, is another aspect of living well. Of course, being in good nutritional status can affect all of those, can't they? Because when we're well nourished, our brain works. You might have more energy and strength to do the things that you need to do for work and for self-care. So nutrition is an integral foundation for living well. Another way to think about living well is in terms of where you are in your journey with your cancer experience. But I like to think nutrition and living well are importantly involved in engaging in building health. Even though you have a cancer diagnosis, you can still be healthy and enjoy other things about your life. And also another aspect is focusing on reducing risk of disease. Rarely does anyone I speak with just have cancer. They may also have high blood pressure, food allergies, diabetes, or some other digestive problems. So being able to manage those diseases as well as tolerate your treatments and cancer side effects go hand in hand. Well, let's move on to beliefs, because what we understand about nutrition can really affect what we believe in life, can it? That's true about many things. If you believe that your car will drive all month long without gas, your daily activities and weekly activities might be different than if you actually had the belief that your car needs fuel on a regular basis. And if you want to get to where you need to be, you want to put good fuel in your vehicle. So in this cartoon, it's a doctor talking with his patient, and the patient says, I try to eat healthy. I never sprinkle salt on my ice cream. I only eat decaffeinated pizza, and my beer is 100% fat-free. So those are some beliefs, but they may not help him support living well or managing his side effects for cancer. So let's talk about some nutrition truths and facts as they may relate to cancer. The truth is out there, as we say, if you only know where to look. How many people, if they're interested in cancer nutrition or another aspect of food, how many people will go to the internet and do a search about that topic? I did a search this morning just in preparation for our talk today, and I put in the search engine nutrition and cancer, and in less than 1 second there were 6,600,032,000 citations about cancer and nutrition. It is thought that only probably 20% of the information we find out on the internet is true when it comes to nutrition and cancer. When I modified my internet search to scientific nutrition and cancer, I only got 2 million citations. So we have to be careful sometimes where we look for information, don't we? But let's look at some nutrition facts or fictions and see which one you think are true or believe. This cartoon kind of emphasizes what I just talked about doing internet searches. A little student says, "What do you mean? All my facts are wrong. I copied everything straight from the internet." So be careful where you get your information. Well, first, let's look at sugar. Sugar is, I think, something that comes up in probably 90% of my consultations with people with cancer, their caregivers. Does sugar feed cancer? Does cancer feed on sugar? These are some important questions that we hear. Well, actually, that's mostly a false statement. Sugar does not cause cancer, and cancer does not feed on sugar. There's really no strong evidence that those two statements are true, but it is very complicated. Foods and beverages that are high in concentrated sugars are often very high in calories as well. So there is an indirect relationship between using large amounts of highly sugared foods and beverages and cancer risk. If those foods cause you to be obese or way more than's healthy for you, because being overweight or having high percentage of body fat is related to 11 types of cancer. So there is an indirect relationship between sugar and cancer. Also, foods that are that are concentrated rather in sugars and sugar sweetened beverages tend to be very low in nutrients when compared with the foods that they might substitute. For instance, apple pie can be 300 calories per serving and have trace amounts of the maybe vitamin C or fiber, whereas if you ate an apple, that's usually 60 calories, and an apple itself is packed with, fiber vitamins, water, and some trace minerals as well. So when we eat foods that are low amounts of nutrients in them, it can weaken our immune system, which can make us at higher risk for developing cancers. But what is the truth? Well, there's no direct link between cancer risk and sugar. In fact, if you embark on a meal plan and try to eliminate all sugars, you cannot prevent sugar from entering in cancer cells. Sugar is the energy all of our cells use for energy. It's our fuel. If your cancer cell doesn't have that energy, it will get that energy from other sources by breaking down some of your body tissues. So there's really not a great effect in trying on your body if you try to eliminate sugars. What is recommended is to limit sugar sweetened beverages, replace sugary beverages like sweet tea, lemonade, sports drinks that are sweetened with sugar, and replace them with water and unsweetened tea, unsweetened coffee. And choose foods that are not often processed with sugar. So if you can have an apple or a baked apple in place of apple pie, that is a great swap out. Not to say you can never have apple pie, but you just wouldn't necessarily want to have it every day. It tends to replace healthy choices in your menu for fruits, vegetables, and protein. Well, thinking about cooking in the winter, I don't know you all, but I tend to cook more in the winter months. How can we make over our recipes and menus to have less concentrated sugars? Well, one idea is to, if you're baking, reduce the amount of sugar that the recipe calls for by at least 1/4. So if your recipe for cake calls for 1 cup of sugar, try to reduce it to 3/4 cup of sugar. Often you'll get a very similar and acceptable product. Also, instead of having beverages that are sweetened with sugar, try to flavor your beverages with natural things like cucumber slices. You can freeze fruit in the freezer and make little cubes to put in your water, tea, or other beverages. You can also dilute juices with a little cranberry juice or other juices, or use a sprig of rosemary. For breakfast, instead of having the usual 12 or 16 ounces of juice, which doesn't have all the nutrients pieces of fruit have, try a fruit cup instead. At snacks, instead of reaching for sweet treats at snack time, maybe have salsa, which counts as a vegetable, and some whole grain chips. Desserts as well, try, instead of cakes, pies, candy, try some ice pops, yogurt, or fruit. Next, let's touch on another interesting topic, non-genetically modified organisms and organic foods. Are these the best choices for me? Fact or fiction? Well, actually, there is no strong evidence that organic food and non-genetically modified organisms are going to change your outcome on your cancer journey. Currently, there's insufficient evidence to lead you to this decision, although in food marketing, we see that quite often, and also in some of the literature we see online or here in public. People often are persuaded that organic food and non-GMOs are the way to go. I think using those foods is fine. However, they tend to be 2 to 3 times the cost of traditionally cultivated foods. So if using those foods limits the amount of fruits, vegetables, and grains that you can consume and prepare for your family, I think it's wise to try to prioritize what's most important in your meal planning and grocery shopping. Another fact that people often don't realize is organic food actually does not have a higher nutrient content in most situations than traditionally cultivated food. Organic food talks about how the food is grown, but it doesn't talk about the nutritional content of that food. All right, so what the bottom line is about organic food and non-GMO foods is if you can afford them and enjoy them and get them on a frequent basis, then that's fine. But the most important thing is try to eat 4 to 5 cups of plants per day. Fruits, veggies, grains, beans, nuts, seeds. That's what's really going to change your immune support and hopefully help you manage your side effects from cancer and cancer treatment. An alternative to organic food is to seek foods that are grown near your home. Foods that are grown by local farmers travel less far to get to our markets, don't they? So they have much less of a carbon footprint than foods that may be grown, 300, 500 miles away and have to be transported to market. Also, talk to your farmers, people that are growing their foods, see what practices they use. Getting the organic food label can be very expensive for small farmers, and many farmers may use the same practices as required for the organic label. So you may be getting better food grown closer to home by working with some of your local farmers and garden centers. So start with plants as the focus of your food as an important step. So in Canada, my colleagues that helped me prepare this presentation, including Caroline, she investigated and found that there are just 4 GMO crops that are widely grown in Canada. And a 5th crop, alfalfa, was introduced in small amounts. You can get these crops also grown probably as non-GMO. So there are a lot of choices in Canada about what to choose about genetically modified versus non-genetically modified. Now there may be foods imported to Canada that are genetically modified as well, like apples, papaya, squash, cottonseed oil, and then your milk might have recombinant bovine growth hormone in it. But most milk is 0.09% free of recombinant growth hormone. Adults, humans can't really metabolize or absorb bovine growth hormone. So for most people, it's a very small issue about their milk supply. Well, let's talk about labeling a little bit. In Canada, foods that are marketed organic or non-organic must still comply with the labeling rules for Food and Drugs Act and the Safe Food Act for Canadians. So try to read your labels for your best selections. And labels can really be a friend to you. They can also let you know what allergens might be in the food if you are sensitive to certain food additives or ingredients. Many people in treatment for cancer find that they actually start becoming sensitive to some foods. So label reading might become very important for you. In America, we have something called the NonGMO Project that is from the state of Washington, and they have set out standards for what can be called a non-GMO food. And they have 2 labels to illustrate that the food has been tested by a third-party independent researcher and found to meet the standards for non-GMO. So the label in America can be in color with a butterfly and the green stalk, or it can be black and white. Also, you can scan the label and there'll be a QR code in it to let you know more about that product. The labels, however, don't mean that the foods are any safer or have higher nutrition quality. They just mean they meet the standards set by the NonGMO Project. Organic foods are not necessarily non-GMO foods. In America, non-GMO foods are organic. So there is a little play between those two labeling products. So the bottom line is focus on plants as you start to maybe plan meals and snacks for the week. Plants, we know, come from vegetables, legumes like beans and lentils, fruits, especially whole fruits, grains, and I encourage people to use it. At least when we think about grains, about 50% of the time, try to use whole grains, if not more. Nuts, seeds, spices can be plants, herbs, and tea and coffee are also plants, aren't they? Plants have special biological components in them that you can't get from a bottle or a vitamin or mineral tablet. Those special components are called phytochemicals. Phyto means plant. It comes from the Greek phyto, phytochemicals. And there are hundreds of them. But phytochemicals help protect your DNA from damage at the cellular level, from being damaged and precancerous. Also, phytochemicals in these natural foods can help you as well reduce the rapid reproduction and division of cancer cells. So eating plants on many levels is a great idea and strategy on your journey with cancer, or if you are trying to reduce your risk of future cancers. And this picture comes from the Canadian Food Guide. Another thing about plants is think about using the plate or bowl method as you're planning your meals. If we think about a plate or a bowl, it could have 4 sections. One section could be covered with lean protein, and that could be from plants, beans, tofu, nuts, seeds, or it could come from animal protein, like our beef, lamb, pork, chicken, turkey, or it could be fish. It could be from other animal products like eggs, cheese, yogurt. 25% of your plate is suggested to be from grains, especially whole grains, or it could be starchy vegetables like potatoes, corn, things of that nature. The remainder of your plate is suggested to be filled with fruits, vegetables. If you haven't had beans at that meal, it could also maybe include beans, nuts, and seeds. So using the plate or bowl method is one way to help you gauge how healthy your meal is. At snack time, I often recommend to people that they have at least 2 different food groups represented at a snack. So fruit and cheese, or whole grain crackers with a nut butter, yogurt with a cereal topping, or a small smoothie that might have yogurt and vegetables. Those are examples of 2 different food groups at a snack. So let's next look at weight loss. Many people who are on their cancer journey are excited when they start to lose weight and lose weight rapidly. Sometimes adults especially may have struggled with their weight their entire life. So seeing some weight loss happen sometimes is a joy to them. However, losing weight rapidly is not recommended during cancer care. So let's look at why that is. So it's actually fiction that popular diets, and like the ones promoted by stars and and our actors, they're not recommended during cancer care, and rapid weight loss is not recommended either. Really, cancer care is not the time to start limiting your diet by nutrients or calories, unless there's a medical need. There are some treatment protocols that interact with certain nutrients. So in that stance, yes, it would be recommended to follow a restricted diet that your oncology team has recommended. Popular diets, and we'll look at a few here in a minute, they're often based on testimonial studies put forth by one or two people, or they might be from theories or from plant or animal studies, not clinical studies done on large amounts, large numbers of human participants that can be read by other scientists. Unfounded diets that you might find online or hear about really do not have sufficient evidence to prove their safe use in cancer. And rapid weight loss during cancer care can actually damage our immune system. If we don't take in enough calories and we're losing more than 5% of our body weight per month, guess what? That weight often isn't coming from fat, it's coming from tissues, lean body mass, our muscles, our connective tissues, maybe even some of our organs. So weight loss is something to really discuss with your treatment team. So weight status is just one of many health indicators that are monitored during your journey with cancer. So try not to focus just on one thing like weight. Look at the big picture about you and your health during cancer and living well. Focus on nourishing your body. What can I add back to my menus, my meals and snacks to help support better health and immune function? And do ask for help early if you do have some side effects like fatigue, poor appetite, or digestive problems, which often lead to involuntary weight loss. Well, let's think about some of the popular diets. There's one new diet book written every week, they say. That might be underreported. I think sometimes there's 2 or 3 diet books presented online each week. But one is the carbohydrate-free diet. That was popularized during some of our Atkins diet rage and the keto plan. But discuss with your treatment team if you would like to go on a reduced carbohydrate diet. You do need some carbohydrates every day. Actually, scientists tell us, the Institute of Medicine tells us that adults need a minimum of 125 grams of carbohydrate per day for support, healing, and tissue rebuilding. So you might try using lower carbohydrate meals, not carbohydrate-free meals. Juicing is also very popular. I suggest people, if they want to juice their own fruits and vegetables, that's a great snack, or it can be a beverage at a meal, but it's an incomplete food. Juicing is an incomplete food, so don't use it as a meal replacement. What about fast? Fasting has been around for thousands of years as a religious practice. Also, nowadays people use it for weight loss, athletic performance. Some people use it as a part of their spiritual journey. However, fasting in cancer care can be very tricky, and it may have profound outcomes. So do talk with your physician before you embark on a fast if you're in cancer care. Gluten-free is very popular now, gluten-free diets. They're promoted for people who don't even have a sensitivity to gluten. Sometimes gluten-free is promoted as part of a clean diet. But gluten, which predominantly comes from wheat and other grains that contain gluten have very important nutritional products in it. So unless you are sensitive to gluten, which means it gives you digestive issues, I don't recommend to people to go completely gluten-free. You might try using fewer products with wheat. Gluten-free products, just like organic foods, tend to be higher in price. And the ones I've looked at often have many additives and ingredients, preservatives added back in them. Some of them are higher in fat and sugar than the wheat products that they replace. So make sure you're aware of that if you're choosing gluten-free foods. The last popular diet that I hear so much about is a whole diet, the raw diet, or maybe all natural foods diet. Often this revolves around fruits, vegetables that aren't cooked. All must be fresh and no canned, frozen, or cooked products. Some people on their cancer journey can't tolerate uncooked fruits and vegetables. They take so much more digestive energy, juices and enzymes to perhaps digest than if they had had those foods cooked. So try to have a combination of raw and what we might call fresh foods along with cooked foods. Well, what about canned and frozen foods? Well, canned and frozen fruits and vegetables and beans are picked at the peak of ripeness, and that often are very quickly frozen or processed and shipped to market. Canned and frozen foods can have just as many nutrients and sometimes more than fresh foods. An example of that is tomato and tomato paste. It takes 6 servings of tomatoes some time to make a tomato sauce or tomato juice. So they tend to have more nutrients and phytonutrients than their fresh tomato counterparts. It is smart to choose, though, frozen foods without extra sauces, cheeses, or seasonings. And you can add your own seasoning at the table. If you're concerned about canned foods and the sodium content, if you rinse your canned foods, you can reduce the sodium content by 65 to 70%. Well, let's think about where we get our nutrition advice. In this cartoon, the baker is telling the consumer lady, of course, donuts are good for you. They're whole grain, whole being the hole in the donut. So be careful where you get your nutrition advice. Who has pets out there? I have several dogs. So if my dog needed surgery, I wouldn't go to the automobile repair office or shop. Although they're very skilled people and technicians, auto repair technicians, they're not in the same science or competency maybe as a veterinarian surgeon who has done many operations and procedures similar to what my dog might need. So be careful where you're getting your information. Let's look at that a little bit. How do you tell about fact versus fiction? Well, just about like in other areas of our life, you can ask the big questions: who, what, when, where, why, for instance. Number one, who is the author of the information that you might be reading or seeing online? .gov often in America means it's a governmental agency, and those are some of our top scientists like cancer.gov. If it's a .edu, that means it's an education institution, also can be a great source of information. .org can mean a not-for-profit organization like the Leukemia Lymphoma Society. Those can be good sources of information. Also look to see if the author has advanced training in nutrition and oncology. Not all health professionals are required to take nutrition courses and certainly would not have advanced degrees in nutrition. So look to see what credentials that person might have. Also, when was the date of the reference? Nutrition changes yearly, sometimes monthly, it seems. So try to look at research and articles that have been written in the last 5 years if you're trying to make decisions about what to eat. What kind of information is shared? Is it scientific information or is it marketing information? Is the article or website selling products marketed to people with cancer. Unfortunately, that happens quite a bit, that products and devices are marketed to people with cancer. Any decision about those kinds of purchases should be discussed with your oncology healthcare provider. How is information presented? We believe the best information comes from large clinical studies that have many thousands of human subjects in the study, and the study design can be replicated by other scientists. So be careful about taking information and changing your diet based on testimonial, which might be one or two people, postings, advertisement, or a point of view article. Also consider food first as your source of nutrients and nourishment. And for most people, it is possible to totally get all the nutrients you need from a variety of foods at meals and snacks. There are over 40 nutrients that the adult human body needs. And so using that as a point of reference means you probably need a variety of foods each week to get all those nutrients. Each food has usually 3 to 5 plus nutrients in them. So eating an orange is an example. An orange has vitamin C, it has fiber, it has water, it has potassium. So all those nutrients are very important in our journey with cancer. You can't get that in a single vitamin C tablet. And there's an important synergy or cooperation and coordination of the different nutrients and foods that really support our body. For instance, our microbiome, the important part of our digestive tract, where our good bacteria live, that is where 80% of our immune cells are produced. So eating a wide variety of foods each week helps support a healthier microbiome, healthier in terms of the quantity and quality of your microbiome. So people who only eat 12 types of food or less per week tend to have the smallest and weakest microbiome. People who eat 30 types of foods or more per week have the strongest and highest quality of microbiome. Beware of thinking that dietary supplements can cure cancer. That's not the case at all. Food and nutrition is a great foundation for your journey during cancer and after treatment. And do talk with your oncology team about any supplements you may take. Some supplements, even though they might say organic or whole or natural, some can interrupt the good works of your treatment or the good effect your treatment can have on your body. Hydration is very important. Did you know that 75% or more of our brain is water or hydration, as well as our muscles? Hydration, like water, helps cleanse our body and rid our body of toxins and waste that our body produces every day. Hydration also helps circulate nutrients and medications that you need, and iron and oxygen around your body. So hydration is very important to help you rebuild your body during treatment, and also to feel your best and have the best immune response. So many times we talk to patients about hydrating well, and they don't understand sometimes why it's important, but I just wanted to share that with you. This slide talks about how important hydration is. Many fluids count as hydration. Sometimes people think, oh, I have to drink all my fluids as water. I like to recommend to people at least half of their fluids should be water, and the others can be tea, coffee, juices, soups, popsicles, jello or gelatins, sports drinks. How much should you drink? Well, everyone has their own hydration goal. The good place to start is 64 ounces as a minimum of fluid per day. Some people need to drink more than that if their cancer treatment has especially negative impact on their kidneys. Your goal might be 72 or 80 ounces of fluid a day. I like to use the rule of 6 when trying to think about fluid. Fluid, I feel, can be scheduled just like your meals are. It's smart to have fluid at least 6 times a day so that your food, your medicine, your nutrients can all be circulated efficiently throughout your body. And make it fun. You know, water to some people doesn't taste good, so maybe put some fruit in it, put a dash of juice in it. Like we talked about before, make your own ice cubes with little pieces of fruit or juice to flavor it. A cup of water is equal to 8 ounces. That's also the size of a baseball, just to give you a frame of reference. So 8 cups a day or 8 baseball servings of fluid is one initial goal for you. Well, how can you schedule your fluids? Well, one idea is to have 12 ounces of fluid with each meal, and that can be as a beverage, soup, popsicle, anything that counts as a fluid. And then between meals, mid-morning and mid-afternoon, have 10 additional ounces. And then have at least 8 ounces of fluid in the evening after supper. That's one way to schedule your fluid, but everyone has their own lifestyle, and what works for one may not work for another. But that's one idea to think about it. And you can use the LLS Health Manager app to help you track your fluid intake. I find setting an alarm on my smartphone helps me remember as well to drink if you don't tie it to a meal or another event. Some people also have to drink at least 8 ounces of fluid to take medication. So that would be an additional source of fluid for you. Do beverages with alcohol count as fluids? No. So that's a great discussion for your treatment team. Is consuming beverages with alcohol safe for me during treatment or before surgery, after surgery? Alcohol is a known carcinogen for humans. And if you do drink, and if your doctor approves that, to keep it to a minimum. That would be 1 equivalent drink per day for women or less, or for gentlemen, 2 equivalent drinks or less per day, not to be saved up for holidays or weekends. It would be better for you to actually eat the food from which that alcoholic beverage might be produced, like the fruit, the grapes, or the grains. So in summary, cancer changes everything. It changes our ability to eat, our outlook, how we process information. It can also change our body's ability to digest food. What we used to love to eat, maybe you like to have a salad every day, but fresh vegetables may not digest well for you after cancer or during treatment. So managing these side effects as well as your other health conditions is important. Let's think about side effects. On our nutrition website, pearlpoint.org/mynutrition, we have over 28 side effects that are frequently known to happen during cancer and cancer treatment. With each side effect, like anemia, bowel and bladder problems, etc., we have a list of strategies to consider to help you manage some of those side effects, as well as working with your treatment team. So support your best strength with healthy food often. You're like a really expensive sports car, luxury car, and it requires the best fuel you can find for it. You will be able to have a finely tuned engine and go further when you feed your body good fuel. Lean toward whole and plant-focused type meals and foods. There's not just one diet or one meal plan for cancer. Any of the healthy eating styles that are nutritionally balanced might be something to talk with your treatment team about, like a heart healthy diet or the DASH menu or the Harvard School of Public Health, their healthy eating plate. There are many healthy ways to eat. Make meals interesting and choose foods that you can prepare with your strength and any limitations you might have from treatment or cancer. Be sure to ask others for help to help you shop, cook, or store food. Many people want to help, but they may not know how to help. So be sure to keep a list of things that would be great for neighbors, friends, or family members to do to help you get your food. And be sure to don't forget other health concerns you may have, like blood pressure, diabetes, or digestive issues during cancer care. So keep calm and ask a registered dietitian. We have a list of other helpful nutrition websites here that you can take notice of, and as well as at the bottom are 2 LLS and Pearl Point websites. So now I think we're ready for some questions.
Thank you, Margaret, for taking the time to go through your presentation and share with us your expertise on nutrition and cancer. If you could just advance the slide, please.
Here we go.
And you're absolutely right. It is now time for our questions and answers. I've been watching the chat box and the Q&A box, and we definitely have lots of great questions, as well as some that were submitted prior to when you registered. So if you still have questions, there's still time to drop it into the question box in your Zoom webinar panel. And we'll go ahead and get started. So I'm going to take some questions from the panel first, Margaret. And we'll go ahead and start with a few of those here. So gonna find a couple here. What are some of the best foods to replace fish and nuts if allergic to those groups?
That's a good question. What are some good replacements for fish and nuts if you're allergic to them? Well, some oils not made from nuts also have similar nutrient profile, and fish, predominantly people use that for heart healthy type goals. And so perhaps chicken that's cooked, you know, without the skin could also be something to think about, as well as wheat germ or breakfast cereals, especially cereals that have extra protein added back might be a substitute for fish.
Okay, excellent. Thank you. That's great to know. What are some of the best foods to repair your immune system?
All right, what are some foods to repair your immune system? Well, foods from all the food groups are really recommended to help repair your immune system and getting adequate amounts of calories as well. So protein is suggested to have 2 to 3 ounces of protein per meal if you're in treatment. So that would be important. Lean protein is best. So using proteins that aren't fried or grilled with excess fat. Different colors of fruits and vegetables and beans each week have different phytochemicals that we talked about. So getting a minimum of 4 to 5 different colors combined of fruits and vegetables and beans. And when we think about vegetables, it's important to get leafy vegetables every day if possible. Eat cruciferous veggies, things that grow in a head like Brussels sprouts, broccoli, cauliflower, cabbage, at least every other day. And something red or orange every other day. It's important to have dairy foods daily for the protein, vitamin D, and calcium, and to choose heart healthy fats to support your immune system. Looking at fats less than 2 grams of saturated fat per serving is a great way to support your immune system.
Excellent. Thank you. So we hear a lot around probiotics lately. Can you share, should a blood cancer patient take probiotics? And if yes, what would you suggest?
All right, so probiotics are very popular. We don't recommend that you take any supplement like a tablet or capsule with probiotics, because that's a concentrated source of that biological component. However, if you want to eat foods that are rich in probiotics, those are usually healthy for you. They have much less concentration than a probiotic tablet or capsule. So probiotic foods might be foods that are fermented, like yogurt, kefir. It can be things like kimchi, sauerkraut, dill pickles. So many things have probiotics in them.
Mm-hmm. Excellent. And thank you for sharing the different foods where we can get probiotics. So it gives us some thoughts of where to go in our fridge. The next question we have here is, what are the best foods to replace like fish and nuts if you're allergic to those food groups?
Well, I think we just talked about that question, didn't we?
Mm-hmm. So we'll go on to the next one. Someone's having trouble with like severe daily nausea. What tips would you have for them?
So nausea can be one of the larger barriers to healthy eating. So one idea is to kind of explore when you have nausea. Some people, nausea happens first thing in the morning when our tummy is empty. So getting some dry carbohydrates in before you get up and start moving around, certainly before you start to eat any regular food, is helpful. So having crackers, dry cereal, pretzels, or toast helps many people. So coating your tummy, especially in the morning, is helpful. Also, having a schedule for eating snacks and meals. Why? Well, an empty tummy, again, can be a trigger for nausea or can cause nausea to be greater in effect. So eating on a schedule helps. Also, being aware of any certain types of foods, aromas, or spices help. Ginger, cinnamon, clove help some people actually reduce nausea. Other flavors or aromas make it worse, like the smell of fried foods or heavy fried foods or foods with a lot of grease tend to make nausea worse. So trying to minimize the cooking aromas around you is helpful.
Mm-hmm.
Also, there might be maybe a type of food that works better than others. Sometimes people enjoy easy foods that are easy to eat and digest, like a fruit cup or cheese and crackers or half of a sandwich with a small cup of soup might work much better than chicken, mashed potatoes, French fries and Brussels sprouts, which have a lot of aroma.
Excellent. Thank you. Here's a very interesting question. Is it true that chomping ice is common with iron deficiency? And if so, why would I want to eat ice?
Well, eating ice and other objects that may even be considered non-food, like laundry starch or dirt, that's called pica, P-I-C-A. And eating those foods often take the space in your menus in your day for foods that may contain important nutrients like iron, vitamin C, other protein and grains. So eating ice constantly throughout the day can replace eating real food that you need. So it's best to limit ice eating till after the meal, I believe, and that way you'll have room in your tummy to eat your proteins, your vegetables, and fruits.
Mm-hmm. Perfect. Thank you. We've got a couple of questions here around anemia. So what nutrients are best to treat moderate anemia?
What are the best nutrients to treat moderate anemia?
Yeah.
Okay. Well, there are several kinds of anemia, but iron deficiency anemia can be treated with more frequent use of iron-rich foods, especially those foods that make the iron more accessible for absorption. Different foods may have the same amount of iron, but not all of them are absorbed at the same rate. But animal foods like beef, chicken, turkey, eggs, fish have the most absorbable iron, making it easier for you to absorb. So having protein throughout the day is important. There are iron-enriched cereals. Those are an easy way to get iron as well. And then there are some fruits and vegetables like greens, dried beans and peas. And let's see what else has iron. There are iron-fortified grains as well. So those are some ideas. If you don't have meat in your day, it's important to get a vitamin C rich food. Vitamin C in foods helps you absorb the iron from plants, from nuts, seeds, fruits and veggies and cereal. So getting berries, citrus, fruits like oranges, tangerines, peppers, sweet peppers like green, yellow, and orange peppers have vitamin C, as do strawberries. So keeping vitamin C in your day is very helpful.
Excellent. Thank you. I think we have time for probably one, maybe two. So the question here is, how often per week is it safe to eat fish? And the concern is around like the mercury content or the mercury in it.
That's a great question about fish. So for general health, it's highly recommended to get fatty fish at least twice a week. Fatty fish is defined as salmon, albacore tuna, cod, trout, and some other types of fish. Some of those are very low in mercury, whereas other types of fish, like other types of tuna, swordfish, might be very high in mercury. So choosing the fish that are low in mercury content twice a week, or go for 8 ounces a week if you just have it once. It's very important. So there are fish out there that are low in mercury. Not all fish have high levels of mercury.
Thank you. And we're going to squeeze one more in. What foods help to promote saliva production and general saliva production recovery?
That's a great question, because saliva helps our taste of our food be more accurate. And when we have dry mouth, many treatments cause dry mouth. Aging can cause dry mouth, and some medication for blood pressure. So foods to stimulate saliva production often are very tart, like citrus, or a candy that might have citrus in it, like a lemon drop, a lifesaver, the fruit flavored lifesavers, or Jolly Ranchers. Some people freeze little bits of pineapple, orange, a little mandarin orange piece, and then put it in their mouth before meals to stimulate saliva production. Also, just massaging your side of your face can help some people stimulate saliva production. Other people like or find that dill or sour taste can also help you stimulate production, like dill pickles, sauerkraut, and some condiments like tomato ketchup or vinegar products. So it's different for different people, but that's very important. Some people hold a little ice cube in their mouth between meals and let it melt. Not chewing ice, but just holding a little piece of ice in their mouth is helpful too. Working with your treatment team, there are other products you can use by prescription to help with artificial saliva.
Mhm. Excellent. Thank you so much for answering those questions and providing practical tips, to help everyone online to get the information they're looking for. So that does wrap up our question and answer period. If you can change the slide, please.
Oh.
Perfect. I want to thank you again, Margaret, for being here with all of us today and for answering all the questions that we had from everyone online. We'd also like to take this time to thank all those who have made this conference possible. Our marquee sponsors, Astellas, as well as AbbVie, AstraZeneca, Bristol Myers Squibb, Janssen, Jazz Pharmaceuticals, Merck, Novartis, Paladin, and Pfizer. Next slide. Before we do close off for today, I do want to remind you that you are not alone. We are here for you. Please reach out to us for more information about our services. You can call us toll-free or by the email listed on the screen. Also, if you're interested in participating in our Other Living Well with a Blood Cancer Conference, that's happening tomorrow. Our next conference is tomorrow, titled Managing How You Look and Feel During and After Cancer Treatment. Tomorrow, November 25th at 3 p.m. Eastern Standard Time. So it's not too late to register for the conference happening tomorrow. You can visit us at bloodcancers-conference.ca to register. Again, thank you, Margaret, for being here, and thank you, everyone, for taking your time to be with us. I hope you have a wonderful day and stay safe.
Thank you. My pleasure.